Hi and welcome to Kids Corner with Tona today. And Tona, I have a question for you today. I would like to find out, because I know that pregnant patients have been a big part of your practice for a long time. I would like to know what chiropractic has to offer to the pregnant patient.
Hi Mike, thank you for asking me about pregnancy. So I have been a chiropractor for 32 years and I've been working with pregnant women for most of that time. I've done a lot of research, I've written a chapter in a book about pregnancy, and I taught about pregnancy to chiropractors for over 15 years. So what is our focus when we see a woman who's pregnant in chiropractic care? Well, it's about supporting her with her mechanical frame from the feet up, so that it's as aligned and functioning as possible, and when her pregnancy develops, that she can have a more comfortable biomechanical posture during this time. So we know that in pregnancy that there are hormonal changes that are there to help you as a pregnant woman to allow for the pelvis to expand and also enable that little bit more of a nudging of space when you're going through the birth canal. But that can be very different from woman to woman. So, and it's not just the hormone relaxin, there are all the other hormones in play. And it's not just the pelvis, it's actually all of the body. So that's why some women get very, very flexible ankles and they trip over a lot, or they get other joints that feel, a bit more stretchy than others. But the main thing is that when we look at a pregnant woman, we look at the feet up, because that can also, sometimes some women may have an arch that collapses or it's uneven, and that can make a difference to your pelvis. And then during the pregnancy, we need to make sure that your pelvis is as aligned and functioning as it possibly can, because you have lots of ligaments that attach to the uterus, like the round ligament, and muscles that are in the pelvic floor and muscles that are above in the diaphragm. And if you have a twist or a torsion, that can make a difference to how you house the uterus. So we pay a lot of attention to that alignment to make sure that that is nice and functioning. And chiropractic is also free of using medicine or drugs. So it's something we use with our hands there, and we use it very specifically for the women in their pregnancy, because they have different pregnancies. Some women get very, very hypermobile, others are quite the joints are quite stable all the way through. But we can work with women all the way through pregnancy, and the last 5-6 weeks we work on focusing on supporting them preparing for birth. We often get the birth partner in and show them a technique around the sacrum, so they can be involved helping and releasing the sacrum, enabling the baby or more enabling the woman to deal with the process of birth together with the birth partner in a more comfortable way. So there's lots we can do in pregnancy. We absolutely love to support pregnant women at Lux Yard, and then obviously to check the newborn baby's spine, head and cranium when they're born. So thank you, Mike.